So I want you to think as Botox as something that we use to treat lines that occur because of muscle action. For example, when you frown, when you bring your eyebrows together and you cause the number 11 lines, the angry frown lines, those lines are occurring because the muscle is moving. We're bringing our eyebrows together. So what Botox does is Botox is a solution. It's a neurotoxin that we inject into the muscle to weaken its activity so that you cannot frown as much. And if you can't bring the eyebrows together as forcefully, you can't create the lines. So what it does is, if you imagine a muscle like this, instead of it being able to flex completely, Botox just weakens the power of the muscle so you can't have that angry frown complex.
Wonderful. How long do Botox exactly, how long does it last?
So it depends on how large the muscle is, because if you have a very large muscle that's very powerful, it's going to wear off in a quicker amount of time. So typically we tell patients anywhere from 3 to 6 months, depending on how large the muscle is. Now, just to go back to fillers, they're a little bit different. Fillers, on the other hand, we use for revolumization of the face, meaning that we use it to lift and plump certain structures that start to age. The analogy that I like to give my patients is that when we are young, our face is kind of like a well-stuffed mattress. So it's lovely and full and firm. It's full of bone, collagen, elastin, muscle, okay? And the mattress has a tight-fitting sheet on top of it, which is the skin. And when we're young, everything is like a gorgeous round peach, full, firm, tight. But as we age, the mattress loses its stuffing. So we're not just losing fat or collagen, we're losing bone, muscle. It's a biometric volume loss. And basically the mattress is shrinking. And when the mattress shrinks, the sheet stays the same size, which is the skin. So if the sheet stays the same size, it's going to start to hang because it doesn't have the support of the mattress. So where dermal fillers come into place is that they are a substance, a sugar molecule, that we inject into the mattress to revolumize the mattress. For example, if you develop hollowness underneath the eyes and you have shadowing underneath the eyes with dark circles, we can lift that hollowness back up to take away that sunken appearance. If you have nasolabial lines, we can also lift those up so that you have a much more natural, youthful appearance to the face.
So that is laugh lines, or we call laugh lines in a sense?
So laugh lines are actually when you smile and you have these little lines that occur out here. Those are the crow's feet. So those are Botox. So when you smile, when you move the muscles and you tense the muscle and you see the lines, that's where we inject Botox into that area to soften those lines. Whereas other lines, for example, the nasolabial lines, the marionette lines that occur down here, that's where we use dermal fillers.
Okay, so you mentioned the dark circles around the eyes.
Yeah.
I know it's a very sensitive area. Can that be used on anyone?
So interestingly, the most common filler that I perform in clinical practice on a day-to-day basis, I do at least 3 to 4 a day, are dermal fillers for the tear trough region, so underneath the eyes. In our population, the 2 most common causes of dark circles around the eyes are, first of all, hyperpigmentation, so discoloration around the eyes, which especially in the Indian population is genetic. So they're born with more pigment cells around the eyes, and that gets worse with age from, inappropriate use of waterproof mascara or rubbing very harshly around the eyes to take off your makeup. The pigment can get darker, which we treat with topical agents. But pigment is one part of the equation. The other part of the equation is that we tend to see a sink, a hollowness underneath the eyes. So no amount of makeup or concealer can cover this, because concealer can cover discoloration, but it can't cover a sink. And so what happens in the sink is that when the light hits the face, it reflects on the cheek, because this is a convexity. It reflects on the cheek, but in a concavity, in a sink underneath the eyes, it shadows. So it looks like we have dark circles, but it's just a hollowing, a shadowing underneath the eyes. So what we do is we use dermal fillers, and there's different types of dermal fillers that we use in different parts of the face. So the area like the tear trough region underneath the eyes is a very thin, delicate area. So you have to use a filler material that is very much like water. So it has a low viscosity and it's very soft, it's very natural and subtle. And we use that to just replace the lost volume in that tissue.
How long does that last in the tear trough region?
So dermal fillers can last anywhere from 2 weeks to 3 months to 6 months or 2 years. It depends on which type you use. So the ones that we use in clinical practice can range anywhere from 18 months to 2 years time.
So apart from the dark circles, acne scars, would you also recommend this for acne scars?
Yes, so I think that one of the best quotes that I've ever heard about scarring, and this comes from Dr. Jill Wabel from Miami, who is an amazing scar queen and a scar expert. I love this quote that I once heard her give at Harvard University, which is that a scar can never be perfect. You're starting with imperfection and you can never make it 100% perfect. But the more TLC and the more things that you give to the scar is the better the scar will look. So I think a multimodal approach with a scar is really most effective. So in our practice, we use topicals. We use topical agents to increase collagen and elastin production by the cells, which help to remodulate the scar. We also use lasers for the scar tissue. But we do also use certain fillers where we go underneath the skin, and what we do with the filler is we basically lay a blanket underneath the scar, because a scar is a depression. So again, because it's a depression, when the light hits it, it's going to shadow as opposed to the surrounding skin. And the beauty behind fillers, Verna, today in 2018, is that you can use fillers to play with light. So with a scar that reflects in a blue color, you can use different fillers to cancel out that blue light so that you don't see the shadowing anymore. So really we're playing a trick on light with the face, and we're bringing back more light and less shadows.
How would you describe the technology that you currently have at the Skin Health Institute rather?
So I think that with dermal fillers, there are many different types available on the market. You have ones that are made of calcium hydroxyapatite. You have ones that are made of hyaluronic acid. So there's many different types out there, okay? My preference is always to use the most cutting edge one, but also the safest one for the patient. And with regards to dermal fillers, the safest dermal filler to use is actually hyaluronic acid, because hyaluronic acid is something that we can get rid of if we need to. Meaning that if you have a complication, if you have a lump or something, we can put something called hyalase into the skin that will dissolve the hyaluronic acid. This is something that has been around for some time, and it makes it the safest. But what's also great is that if the patient has a suboptimal result and didn't like something, you can get rid of it. And now what we're doing a lot is that there's a lot of injectors out there who are overdoing fillers, or their techniques are not current or up to date, and they're giving a very false and unnatural appearance to the face. And so patients are coming in, and we're using this molecule, the hyalase, to get rid of bad work, to break it down so that we can start from scratch and redo it.
When you talk about good work and bad work, would you say it's both a combination of the products that you use and also the healthcare professional?
I think that dermal fillers and Botox is an art. I think it's this beautiful meld between science and artistry. And just like if you have a Picasso, if you have a beautiful painting, it's not the brush and it's not the paint that makes the Picasso, it's the artist. And the artist has to have a good eye, but also has to be fully trained in the field that they're in to know how to deliver a Picasso piece. So I think where the discrepancy is happening now is that the most common question and concern that patients have globally, this is not just in Trinidad, globally, the most common concern that they have is that I don't want to look fake. I want to look better, but I don't want to look different, and I don't want people to realize that I've done my cheeks, or I want it to look very natural. And that is a global concern amongst patients. And the reason for that is because this has been a field that it's so new, it's so current, it's so cutting edge. Where does it fit? Is it plastic surgery? Is it dermatology? Is it cosmetic medicine? Where does it fit? And because it's so new and current, there's a lot of unregulated areas in this field. So what you'll find is you'll have a lot of physicians like an OBGYN who delivers babies going and doing a weekend course in Botox and fillers, and then starting to offer Botox and fillers in their practice. And then they're doing maybe 1 or 2 patients a week. You're never going to have an amazing result with somebody with that little amount of expertise and education. That would be like me in my practice, where I do 10, 15 cases of fillers a day, saying, okay, well, I'm going to also deliver some babies just to make some extra money. It's not going to work. So I think that you have to research your practitioner, and studies have actually shown that only 1 in 9 patients actually research their aesthetic provider. So they go into their dentist and they say, oh, my dentist offers fillers. I guess that's going to be the same as what I see on Dr. Eckel's page. And they let the dentist do it, and then they end up in my chair having to dissolve the bad work. And you end up spending more money because you pay for your filler, then you have to get it dissolved and then re-inject it again. So I think my message to the people of this beautiful country is take time to research who your provider is. What is their level of education? How long have they been doing this? Is this something that they're doing every day? Like, for example, in our clinic, I do 10 to 15 cases of this a day, every day, day in and day out. And also, you have to stay up to date. I go to conferences all over the world. I spend time with the best injectors. This is where my focus is. This is what I'm doing every day, day in and day out. And how I was practicing a month ago is different to today because it is such a rapidly evolving field.
So let's talk a little bit about the age group. At what age can treatments begin? And is there anything as too much Botox or too much fillers?
Yes. So I think that fillers have a very diverse use among patients, depending on what the indication is. So you can use fillers in a younger patient for beautification. Let's just say, so in beautification, what we're talking about is harmony in the face, okay? So we know that we follow certain proportions in the face, okay, the Fibonacci sequence or the rule of pi. We follow certain Da Vinci proportions in the face to achieve symmetry and beauty. So it's all about things working together, because you could be born with the most beautiful pair of lips, but if those lips don't match the face, if they don't match the cheeks and the jaw, the lips are not going to work. So it's all about bringing harmony and balance and symmetry to the face, okay? So in a younger patient, it tends to be more beautification, making things match, making everything line up. In an older patient, it tends to be more anti-aging. So as we age, certain things will happen. We may get hollowness under the eyes, we may get the nasolabial folds that we spoke about, and also we may have changes in our musculature of our face, which lead to certain things like, for example, the smile. When we age, when we're young, our smile is very small and well supported by our muscles and our collagen and elastin. So when we smile, the lower lip is raised and the smile is quite narrow on the sides. But as we age and we lose volume throughout the face and the cheeks and the lower face, the smile almost becomes a caricature of our younger self. And the smile becomes this big, open smile that you can see all the back of the teeth, and the lower mouth, the lower lip drops. So you get this very big, I'm going to eat you, as my patient said to me yesterday. So when you do fillers to the face and you revolumize, you support the muscles of the face and you have a much more youthful smile.
What is this new trend of myomodulation?
Myomodulation is something that is quite new with dermal fillers. So I think the beauty with dermal fillers is that just like any drug, when we first start to use it, we realize, okay, this works, but then as we use the drug more and as we get more familiar with it, we learn how to use it better and how to get the very best out of it. So when we started with dermal fillers, it was like, wow, this is an amazing molecule that can lift lines and can plump the face. But as the years have evolved and our technique has gotten better, what we knew is that we can actually use fillers to change muscle movements in the face. For example, last week, I did the first Bell's palsy case in the Caribbean with dermal fillers. So this is a patient, for example, who had Bell's palsy, which is a paralysis of one side of the face. So her muscles don't work. And the other side is normally active. So she has a very crooked smile. And as a result, the smile is like this. Yes. It's very, very active on one side. And as a result, she doesn't take pictures, she doesn't smile, she's housebound. She's very, very self-conscious about this. And we did dermal fillers in one half of her face to myomodulate her muscles, meaning that we put it in a certain layer to give the muscles, the overactive muscles on one side, some support so that we return the smile to a natural, normal smile, so which is much more aesthetically pleasing. Interestingly, she had been to about 5 or 6 plastic surgeons all around the world, and nobody would touch her. Nobody would do anything with her. They said, this is not something that we can improve. But now, with dermal fillers, in 5-10 minutes time, we can replace your tissue. We can give you back that natural smile and bring symmetry to the face.
Wonderful. That sounds fantastic. What are your closing comments, Dr. Eckel? What would you like to say to those looking on, wondering if they should really, take that risk?
I think that dermal fillers and Botox, the studies have shown that they are becoming increasingly more popular. And the trends that we're seeing, in 5 years' time, it is going to be just as common as brushing and flossing your teeth. And I think that this concept that you look fake or you look done when you have this work is very archaic and very outdated. I think the new generation of injectors who are very skilled, who know how to use these products properly, will give you the right diagnoses for your face, keep you looking like you, but the very best version of yourself that is never done, always natural.
Wow, sounds fantastic. We'd like to just take this opportunity to thank you so much for taking the time to come here on set and educate us and give us hope that we can beat this aging process. Always a pleasure chatting with Dr. Rachael Eckel, cosmetic doctor at the Skin Health Institute. A whole lot more when we return. Stay tuned.